Welcome to Orthodontics Part 2. This slide presentation is directed toward the dental assisting student, and this slide presentation covers treatment and armamentarium. Let me say that again, armamentarium. First, let's look at orthodontic instrument setups. Now, for infection control, orthodontic instruments should be sterilized and kept housed in either a cassette, which is wrapped for various orthodontic procedures, or as individual instruments, you can, or by setup, you can put them in sterilization pouches. And they should be kept sterile by being wrapped or in a pouch prior to patient use. The old methods of setting up your instruments in orthodontics was usually some type of a rack that you had all your orthodontic pliers and armamentarium. You can see I have a thumbs down here because as far as infection control standards, this is not a infection control way or a sterile way to keep instruments. In California, this is illegal according to the Dental Practice Act. So they must be kept in a sterile environment prior to patient use. So that means if they're in a drawer, they should be wrapped in a cassette or kept in sterile pouches. There are a sequence of appointments for corrective orthodontics, also known as a treatment plan. And certainly this varies from patient to patient, case by case, and so it is up to the orthodontist or the general dentist practicing orthodontics to determine the best treatment plan for the patient. But generally, you will have diagnostic aids and measurements, placement of separators, placement of bands, placement of brackets, and archwire, and ligature placement. Now this is an ortho tray setup. Certainly does not represent what I was talking about with a sterile setup, but this is an ortho tray setup that's used in a student lab class where we work on mannequins. And then this is the second part of that tray setup. So you can see just from the setups there are a variety of instruments that are used in orthodontic treatment. So first let's start out with obtaining orthodontic measurements or ortho measurements. These measurements can be done indirectly, which would be with a patient study model, a millimeter ruler, a bola gauge, a bow divider, and a pencil should be here. And the ortho measurements usually obtained would be arch circumference, arch length, teeth measurements, and classification, as we saw in part 1. So the classification of occlusion or malocclusion, information about the patient's bite, over jet, over bite, and open bite. Now, with our wonderful age of technology in dentistry, there is orthodontic software that can obtain these measurements either indirectly with still the use of study models or directly by scanning the oral cavity. Another part or appointment of corrective orthodontic treatment may be to use a band, which eventually you'll see will hold the arch wire. And so to place this band, usually we need to create space between the sixes. Remember, this is the Palmer method. The first molars is a very common tooth to place a band. So one type of separator, or also known as seps or spacers, is the elastic separator. It can be placed with an elastic placing plier or 2 pieces of floss. And there are many really good videos online, so if you are just watching this online or seeing my slides, you may want to go online, or perhaps you're in a program where you're actually going to learn how to place this on a mannequin. And then another type of separator is called a TP spring. Sometimes, for whatever reason, elastic separators just don't stay in a patient's teeth, in between their teeth. So an orthodontist may choose to use a TP spring separator. And keep in mind that separators, they should be placed to encircle the contact so that they will create space. They can't be below the contact because that'll just impinge the gingiva. If they're above the contact, they're not fitting in between the teeth to create space. Other types of separators, while it's very old-fashioned, I just want to show it, a brass wire separator. So it's a little piece of brass wire that is placed to encircle the contact, and then it is twisted to make a pigtail, and of course the pigtail end is cut so that it's not too long in poking the patient. Another separator is a dumbbell separator because it looks kind of like dumbbell weights that are used at the gym. These separators could also be called chairside separators. Generally, orthodontic separators should stay in between the teeth for about a week. And then the patient comes back. There's plenty of space if the orthodontist is going to use a band. And sometimes these fall out. Patients are always instructed to call the office if they fall out because we want to put them back in. Well, sometimes that doesn't happen. So patient comes in and you're looking there like you see that you have placed so many separators and they're not there. Oh, and the patient says, oh, they fell out. And so it's kind of a hassle actually for the office because you've already set this patient up for a banding appointment. So these chairside separators may be effective by placing them in between the teeth, and then you have the patient wait for maybe 10 or 15 minutes. But depending on the teeth themselves and the periodontal ligament, it may not create enough space, and then you'd have to have them come back anyway. But sometimes it's worth a try if it doesn't mess with your schedule too much, okay? Interfere with your schedule. Now we have orthodontic bands. So we have a kit here that has a selection of sizes that you need to size from mesial and distal, buccal and lingual of the tooth. And this is a picture on a typodont of a archwire tube that is on a band. And the archwire, which we'll see in a little bit, will be fitting into this archwire tube that happens to be on a band. If you're going to place bands, there are a few instruments that are used. One is called a band placement instrument or a bite stick, where you place the band over the tooth and have the patient bite down, and then it seats the band. You may also need to use a band pusher. This is a Weingart, which could help just to bring the band over above the tooth, or a Howell plier. And then once they're fitted or sized, then it needs to be removed. So this is a band remover. Another very important component of tooth movement is the bracket. And brackets are usually bonded onto the teeth. It's very important that the bracket be placed in a specific area because it does direct the tooth movement. So they're normally placed in the middle third. Of course, this typodont has very straight teeth, but it may, depending on the case, be either turned or moved in a different position. But this is very typical, middle third of the teeth. You can see here that we have the archwire tube actually bonded to the teeth instead of using a band. So that may be a way to place an archwire tube instead of the band. Brackets are bonded, so you want to review what are the steps and armamentarium for bonding. Here are some ortho brackets and placing instruments. So they usually come in a kit. They're all assigned to specific teeth. So if you're assisting or if in your state you can actually place and align them, you want to make sure you have the correct bracket for the correct tooth. Isolation is important, and so we have a retractor here and a tongue guard. This is a bracket placement plier, or tweezer, excuse me, bracket placement tweezer. A hemostat might be helpful in positioning the bracket, and an ortho picker or a scaler could also be used in positioning the bracket. Now we have the arch wires, and the arch wire is either made of stainless steel or nickel titanium, also known as a niti. These are the two popular. There are a lot other types of arch wires. They can be round or they can be square. And it's really up to the orthodontist or the general dentist practicing orthodontics as to when they're going to use a certain type of arch wire. Usually nickel titanium or niti can be used for initial ortho alignment. Stainless steel is a working type of arch wire, but again, it is indicated by each case or during the progress of the case. To place an arch wire, one can use a Weingart plier to actually get it fitted into the tube, or a Howell plier, and then the arch wires normally need to be cut or trimmed at the most distal end. And so we have a wire cutter and then a special wire cutter called a distal end cutter. So this is what it looks like when the arch wire is in the brackets, and the arch wire must be placed in the brackets properly and then in the arch wire tube. And so the end needs to be cut. So here's the end, and the advantage of a distal end cutter first is the access because it's angled, and you think about the second molar or the first molar, it's way back there. And the other advantage is that when the distal end cutter cuts the wire, it holds the cut end. If you use just a regular wire cutter, this is not designed to hold the end, and you'd cut the wire and the end goes popping off, flying off into the patient's mouth. Very dangerous situation. And the distal end cutter, once you cut the end, it holds the cut end. So this is a very popular arch wire cutting instrument. Now we have another important step in tooth movement, which is arch wire ligating. Very common is the use of elastic ligatures that are placed around the bracket and on top of the arch wire, and it's to secure the arch wire. Remember, the arch wire is the track on which the teeth are moving. And so in order for teeth to move, you have the bracket, you have the arch wire placed within the bracket, and then we need something to hold that arch wire in place. So elastic ligatures are very popular. They come in different colors. It can be kind of fun for the patient to pick out colors. They can be placed with a hemostat or a Mathau needle holder. You might need some type of a sickle scaler or an ortho picker to help position the elastic ligature. Then we have wire ligatures, also known as tie wires. And this would be if sometimes an elastic ligature just doesn't hold based on the position of the tooth. So a tie wire can be used. It's a small piece of wire and it loops around the bracket, again, comes over or crosses over the arch wire to hold it in place, and you can use a Mathau needle holder to twist it so that it's tight. The circle around should be very tight, and then you would cut the excess pigtail to about 3 millimeters or so. Use a ligature director. This is a little fork here in this instrument, and push it underneath the arch wire so it doesn't poke the patient's mucosa. Another type of ligating would be a bracket with a self-ligating clip. So you put the arch wire in the brackets and then simply push the clip over the arch wire. And I would say that the elastics and the tie wires are very popular. But again, based on the case and the method of the orthodontist, they may use self-ligating. A review here that teeth move by a combination of the bracket in the proper position, the arch wire going through the bracket, and the ligature. And of course, additional appliances may be used. We'll look at that in part 3. During orthodontic treatment, there will probably be a changing of the arch wire, and so that warrants the removal of ligatures. So removing ligatures can be accomplished with an ortho picker or a sickle scaler. Or if you have tie wires, you would need to have a wire cutter, a ligature director to untuck the pigtail. Then you cut the ligature away from the pigtail, but don't cut the arch wire. If you're new in an ortho office, they will remind you, don't cut the arch wire. And then the ligature is removed, and then the arch wire might be changed to a different type of arch wire for other movement. And then you may place the ligatures or arch wires again. If it's at the end of ortho treatment, then the bracket can be removed, and there is a bracket removing plier. Clever name, huh? And then any bonding material should be removed. In California, it is the dentist only with a high-speed handpiece and either a diamond burr or a stone of some sort. Then if bands have been placed, the bands can be removed with an orthodontic band remover. So this is just a picture I gleaned off the internet, thank you very much, of easy orthodontics. Maybe there's a bite here, or maybe this is in treatment. And then, of course, you have these cases which I just titled Real World Orthodontics. I mean, these are the people that really are in need, and I would say that this is definitely for the experienced orthodontic assistant to be placing an arch wire and ligating in this situation. I highly encourage you to investigate what is the scope of practice for dental assistants in your state, or if you're my student, you please review your scope of practice from the Dental Board, California Dental Board Practice Act to see what is the scope of practice for the dental assistant, the registered dental assistant, and you may want to take a look at the orthodontic assistant permit holder. Thank you very much, and I hope to see you, so to speak, for Ortho Part 3.